Now I'm trying to look at the FEPi, okay, which is an abbreviation which is very important in laboratory medicine. And this is the full name is what is known as a fractional excretion of phosphate. Fractional excretion of phosphate. Okay, so what is fractional excretion of phosphate? You know, of course, you're trying to look at excretion of phosphate, but not the total. Do you understand? So just so you know, it's a clinical calculation, and if I'm trying to check for this, I'm trying to access. You can pause to observe this. I'm trying to access on the total how your kidneys are functioning. Okay, particularly in cases of hypophosphatemia. That means this patient is always having low phosphate in the blood, low phosphate in the blood. So I want to now come and see if it is the kidneys that are just wasting the phosphate out. Okay, so what does it mean? It represents the percentage of what filtered phosphate that got into urine. Some of it can be filtered through the glomerulus but gets absorbed back into the body. So I'm trying to now try to see how much of it I was actually able to get into urine. So if it is high, it suggests that the kidneys are not conserving phosphate but it's getting out too much. So you have all those renal phosphate wasting. If it is low, indicates that the kidneys are functioning well and they are gatekeeping. They don't really want phosphate to go out of the body too much. Because phosphate is very important. Okay. So this is the formula. Okay. We have the UPI, PCR, we have the PPI, UCR, and these are the full meanings. UPI is urine phosphate concentration. PPI is what? Plasma phosphate concentration. UCR is urine creatinine concentration. PCR is what? Plasma creatinine concentration. So clinical interpretation, if it's less than 50, shows that the kidneys are conserving phosphate. Okay. So hypophosphatemia is likely due to not a problem within the kidney. Probably there's no absorption, the person is not taking foods that contain phosphate. Do you understand? If it's more than 5%, shows that the kidneys are actually wasting, the phosphate. Fanconi syndrome, hyperparathyroidism, anything that will actually trigger the kidneys to waste phosphate. So why does it matter? It can be able to help you dictate what is actually causing a patient to have low levels of phosphate in the body. Okay, so this is what we have from hypo. Um, that's basically this formula which we use to calculate um, the amount of phosphate that is being excreted in the urine.